Here, if we looked up here, are the causes of ventilation. Like the first one is,
Ryan is with us?
yeah,
Yep,
Oh,
I'm here.
okay.
yeah. Factors that affect ventilation here. Don't care about all this information. Just care about flail chest here, fracture ribs,
هذا
and
حق الفرنتيشن. Just don't repeat it. Anas, just go. Continue.
okay, but fastly, okay. Fracture ribs, flail chest, and medication here, like morphine.
Mm-hmm. Mm-hmm.
So that's it. So let's get into the second slide. Okay. Here are causes of uh, decreased compliance, like airway restriction, like bronchial asthma, inflammation, chronic obstructive COPD here, and pulmonary fibrosis, emphysema, as we said. Here is to the same causes of compliance. It's repeated here too, like inflammation, mucus production, bronchoconstriction, and those mucus production and bronchoconstriction happens with bronchial asthma, COPD, and chronic bronchitis too. Atelectasis, we've said it, and surfactant deficiency too. Okay,
Mm-hmm.
and here is causes of that affect diffusion, like here, decrease the surface area. Where is it? No, just no. It's mentioned here, right? Like decrease our surface area, and also the sickness, like uh, as we said, pneumonia and pulmonary edema, and lastly, things that interfere with blood flow as pulmonary embolism. Okay,
Mm-hmm.
so here is it again: decreased surface area, sickness of alveoli like pneumonia and uh, uh, pulmonary edema, and also things that go against our blood supply, like which is mentioned here. Where is it? Blood clot, or have we said pulmonary embolism? Okay.
Mm-hmm.
Here is the uh, transportation, like congestive heart failure, as we said, and anemia here. Here is anemia, and here is decreased cardiac output. So those two causes that affect our transportation.
Anemia and cardio output.
Yeah, anemia and heart failure or congestive heart failure. Anything that can interfere with cardiac
Mm-hmm.
contraction. Okay.
Mm-hmm.
Okay. So here is it again, like decreased cardiac output or decreased hemoglobin, like in anemia. These are causes that
This
interfere
is the
with,
anemia and heart failure. This is affected
yeah,
transformation.
transportation. Okay.
Transportation. Yeah.
Yeah. Okay. Now here is some examples, as we said, like anesthesia. Why anesthesia interfere with ventilation, Wafa?
لأنها تمنع إنه الاير come in.
No, anesthesia here, well, or anesthesia here, well, block the see
Airway
the respiratory center in our brains. So
blocked.
yeah, the anesthesia will block respiratory center in brain. So the
Mm.
patient, any patient who will make major operations and take in inhaled anesthesia, they put him on mechanical ventilation until
Mm.
or during doing the operation. And
Mhm.
also, if I asked you about fractured ribs, it affect our ventilation, as we said. What about anemia? Yeah, transportation. That's right.
Mhm.
Congestive heart failure affect what? Transportation too, as we said. Asthma affects what? Affects
The
compliance. Yeah, and
compliance.
diffusion too, but it's mainly affect our compliance. Okay,
Mhm.
that's right.
So this is the note is good to study from or no?
It's a bit repeated, so everything is repeated here. Those things with this font is the same here, but those underlined here are better to study because they are concise and have the main points.
Okay.
Okay, so when you're studying, focus on those notes, not the upside here.
Like I have a question. Like my
Yeah,
friend, they told me they bring it in the exam. Like
okay.
what kind of disease affect the upper side of the respiratory?
Yeah, okay. We said that upper respiratory tract consists of nose, okay, pharynx.
But what the kind of diseases affect?
Yeah, yeah, I will tell you. Larynx and trachea, okay? So if there is any disease that affect those, will affect our upper respiratory tract. We say
Mm-hmm.
upper respiratory tract infection. The most common one is common cold. Yeah, common cold is the most abundant or the most popular upper
Mm-hmm.
respiratory tract infection.
Asthma.
Asthma, no. Asthma will affect our bronchioles. So it's a lower respiratory tract infection. What else here? Maybe pharyngitis.
Pharyngitis with this.
It's an inflammation of pharynx, like a bacterial infection of pharynx, and also laryngitis.
What is mean laryngitis in Arabic?
Yeah, in التهاب اللارynx, الحنجرة.
Mm-hmm.
So these diseases is considered as upper respiratory tract infection.
Like asthma is not considered?
Uh, m- uh,
No, asthma's lower because
yeah,
that's lungs.
yeah.
Uh,
Asthma affects mainly our bronchioles and the main bronchus, two main
Mm-hmm.
bronchus and bronchioles.
Mm-hmm.
Okay. So this considered as upper respiratory tract infections. Okay?
Mm-hmm.
Yeah, that's it. So now we said that the patient got into hypoxia, right?
Mm-hmm.
As a decrease of one of those four, ventilation, compliance, diffusion, or transportation. We said that we have two things of hypoxia. Like what? Like here is talking about the difference between hypoxemia and hypoxia. And we said it. Hypoxemia means oxygen in blood decreased, while hypoxia means decreased oxygen to tissues. So we covered this.
Mm-hmm.
Okay.
And the hypoxemia, he has two like acute and chronic, right?
Yeah, that's right. Here we said that we have two types of hypoxemia. There is maybe acute hypoxemia. Here is it.
Hypoxemia is mean low,
No,
like
no,
no
sorry,
oxygen.
sorry. Acute hypoxia. Okay. And we
Hypoxia is mean no oxygen.
yeah, no oxygen to tissues or in tissues or in cells. In
This
our
is it's considering the two, like chronic and acute.
yeah, here is it. Yeah, acute hypoxia here, which we said that this will affect our vital signs, just vital signs here. Like what?
Mm-hmm.
Like heart rate will go up, respiratory rate will go up, and also our blood pressure will go up to
Mm-hmm.
compensate this. And we said that chronic hypoxia, like diseases which is chronic, like COPD,
Mm-hmm.
asthma, emphysema, and mesothelioma, which is cancer in our lungs. Those
Mm-hmm.
will decrease oxygen too. But the
Mm-hmm.
symptoms is kind of different here. There will be fatigue and tiredness. Okay. And the patient will suffer always from decreased energy. They will not be able to do anything. And also, they will suffer from what? Increased their not their breathings or muscle. They will use more muscle to improve their um, respiration. Here is it, like increased muscle use.
هذا in acute in
No,
chronic.
in chronic, yeah, and also increased work of breathing. But we said there's a problem here, and our hemoglobin will think there's a problem in it, so they will increase hemoglobin via bone marrow production, and this will make the blood sicker and sicker. Okay, you got it?
Yes.
You got it, Ryan?
I didn't get the last part, but
Yeah. You got the old information here?
uh, yeah, I have it here. Yeah, no, it makes sense, I think.
Do you have any question?
No, no.
Okay.
Well, it was chronic hypoxia. Asthma is someone with chronic hypoxia, or is that acute?
No, 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 no.
You know that asthma, it's kind of may affect a patient and make acute hypoxemia, but it will take minutes to hours. So it's considered as chronic. Okay. The patient will
Oh,
the patient will
okay.
suffer from hypoxia all the time because there is also always acute attacks of asthma. So, but here we're talking about acute, like there's something that depressed the respiratory centers, like trauma or something that directly affect our respiratory system. Okay.
Okay.
But to be honest, uh, outside your lecture, this may be acute asthma with acute hypoxia. But I'm telling you what your tutor told
خليني
you.
أسأل عبير. Let me
Okay,
ask my.
you got it right?
Yeah, I was just trying to follow along.
Yeah. So okay. So if the patient now
كلام
got
بالعربي اسمها
I'll
يا
be honest,
شو
I
قال
haven't got a
شو قال
chance to listen to this lecture yet, so I'm learning from you right now.
yeah, I'm just telling you the information as your tutor. I don't add anything from outside.
Okay.
Yeah.
so ما فهمت سؤال راين شو قال
Ryan was
قال
asking, is asthma
العربي in Arabic as Anas
هل الأزمة a cause of acute or chronic hypoxia? Okay, your teacher Wafa mentioned that asthma is a cause of chronic, but in reality, it may be a cause of acute. There is something named asthmaticus epilepticus, which is a very severe asthmatic attack that may cause acute hypoxia, but it's not mentioned here. Okay.
they said like asthma happen I don't know where I read this one maybe in the transcript is asthma caused because the oxygen is get low.
Yeah, asthma is a cause of chronic hypoxia as mentioned in the transcript.
Mhm.
Okay. Now, let's move to the next part. I want to know that if the patient have something bad or have a problem in their respiratory system. So as a nurse, what you can watch for symptoms in patients. So what symptoms that will make you suspect there is a problem? Could you think?
Like their respiratory rate, like their breathing patterns, right?
Yeah, that's
What's
right.
this what this in nurse
It's nursing assessment of respiratory symptoms. Okay.
مستخدم جهاز الأكسجين إيش اسمه؟
No. Now we're just talking about symptoms and signs you may find in a patient. يعني المريض هيجيلك بإيه لو هو عنده مشكلة في الرئة أو مشكلة في الصدر.
مش
Okay.
قادر يتنفس.
Yeah, the patient will tell you that, doctor, I can breathe well. This is named as shortness of breath. So it's a subjective data. The patient will tell you that. But if you watch this on patient, it will be dyspnea. So dyspnea and shortness of breath has the same meaning, but this is subjective while dyspnea is objective. Okay. Oh, what else? There's maybe tachycardia. Tachycardia. So what is tachycardia? No, sorry, it's not tachycardia. It's tachypnea.
Tachypnea.
Yeah, tachypnea.
The kidneys mean he has like
Yeah,
breathe
that's a
sound.
patient. It has two criteria. It's fast, okay, and shallow breathing. Like the patient, okay. While ventilation, hyperventilation is kind of different. Hyperventilation is that the patient there is increased rate and depth too, like this. While tachypnea, okay, so there's a difference between tachypnea and hyperventilation. So what else the patient may suffer from? After a short period of tachypnea, the patient muscle will get tired. So the patient may transform it to bradycardia. So the bradypnea means what? Decreased rate of respiration, just rate. Also shallow breathing, like, but hypoventilation will be what? A decreased depth and rate 2. You got it right?
Yep, I'm following along.
That's cool. So what else the patient may suffer from? The patient may tell you that, doctor, when I want to sleep, I can't breathe well. What is the name of this? They just suffer from this when they are going to sleep. So it's named as
Orthopnea.
orthopnea. So orthopnea means the inability to be flat and respirate well. So how you identify that the problem has orthopnea? You tell them that when you go into sleep, you suffer from shortness of breath or dyspnea, or do you need to put some pillows under your back to be able to breathe well or to respirate well? So the patient will tell you yes or no. So you're going to identify orthopnea. Okay.
Mm-hmm.
We have another concept which means paroxysmal nocturnal dyspnea. Do you know this, Ryan?
I'm not.
Here, orthopnea is a patient want to get flat but has difficulty breathing. Okay, but here the patient will be sleeping, and this dyspnea will let him get up. Okay,
Okay.
this is paroxysmal. Nocturnal means night. Dyspnea. So the patient is sleeping, but he got from sleep and suffering from the inability to respirate. This kind,
So
yeah, I will
ما فهمت يا
wait.
أنس يعني
I would
قصدك
clarify
إنه
it. I would clarify it. Don't worry. Paroxysmal nocturnal dyspnea, it's not a kind of related to our respiratory system. This one symptom more related to congestive heart failure, not respiratory issues. الاولى يا اورثوبنيا دي يا وفاء بيجي ينام ما يعرفش فيقوم. انما الباروكزوزمال نوكتورنال ديزنيا بيكون نايم وبيقوم لانه ما يعرفش، ما بيعرفش يكمل نوم.
مم.
اوكي.
يعني واحد إنه يصحى من عز النوم نقص الأكسجين وما يقدر يتنفس، والثاني ما يقدر ينام خالص.
بالظبط، برافو عليك. So this is the difference. Orthopnea is related to chest disease or cardiac diseases, but paroxysmal nocturnal dyspnea mostly with congestive heart failure. So your tutor didn't mention this one here. Okay, I just added it. Okay, so
Oh, okay.
yeah,
Yeah.
So both they are considered not an asthma or is not because the
mostly
drop in
mostly
oxygen rate.
mostly P and D come with heart diseases, not respiratory. But orthopnea may happen with pulmonary edema, pneumonia, asthma,
إيش
COPD,
اسمها إيش
etc.
اسمها اكتبها
Uh, ortho, which is related to
you
position, body
could be.
position. Yeah, and orthopnea. Okay.
Mhm.
So what else will enable you to catch if there is any respiratory problem? If the patient is coughing too much, there is coughing. Okay?
Mhm.
The patient is coughing too much. So that means there is a problem in their respiratory system, or there is a large amount of mucus excreted from this patient. We have
Mhm.
two diseases that increases the amount of mucus. So common diseases, COPD and chronic bronchitis.
Mhm.
What else? If there is something named abscess, if there is abscess in the lung, so the mucus will be very large amount, and also it will be has having a bad odor because there is
Mhm.
bacterial infection.
Mhm.
What else you should look for as a nurse in the respiratory system? Now it's the time to listen to their heart, to their chest. So listening means auscultation. Why you can hear Wafa if the patient has a problem in their chest?
Wheezing.
Yeah, wheeze. What is the meaning of
Wheeze is
wheeze?
considering as asthma, right?
Yeah, wheeze is a sound that comes out of our bronchus because there is a very severe broncho constriction. So it's kind of like trapping air between two pathway. It will produce a sound named wheeze. And this wheeze comes with mostly with asthma and COPD. Okay.
Mm-hmm.
What
Mm-hmm.
else? What else, Ryan? You can add something?
For wheezes.
No,
Oh,
no.
for sounds.
Yeah.
Yeah, there's rails. So that's
Yeah,
like
rails.
and
Rails means what? Means there is a very uh
fluid.
yeah, there's a air will get crushed with water in our alveoli, so it will produce a distinguished sound, okay? Like you're throwing a block or something in a water. And rails, it has another name, names crackles.
Mm-hmm.
Okay, and also a third name means crepitation. So those have the same meaning. Rails, crackles, crepitation, they have the same meaning. Okay, so what diseases that fill our respiratory system with water or fluid and cause this? The most commonly one is pulmonary edema. What else? Pneumonia. The most
This
common,
is all considered as a,
yeah, as an
we can hear it.
abnormal, yeah,
We hear it
abnormal,
as an,
yeah, abnormal lung sounds. Okay.
this is, but what is considered wins? What's like considered
Wheeze,
edema or
yeah, wheeze with asthma and COPD. Those,
COPD.
just
Okay,
those.
sure,
Yeah. Yeah.
sure. How about rail and the crackers? Consider
Rails,
anti.
crackles, crepitation, all of them have the same meaning, comes with pulmonary edema and pneumonia.
Pneumonia.
Yeah. There is some
Pulmonary edema and
pneumonia.
pneumonia.
Pneumonia, which
Pneumonia.
is an
Okay.
yeah, inflammation or acute inflammation of alveoli. So now there's another sound you can hear. Can you hear another sound, Ryan?
Yeah, I remember her saying bronchi.
Yeah, bronchi. But let me add another sound which is important too for exam is stridor. Stridor means there is a very great obstruction of the upper airway. So if there's obstruction here or something like foreign body or anything that
Mhm.
obstruct the trachea or larynx will cause
Stranger. Stranger.
stridor. Yeah, stridor.
Mm-hmm.
It's a sound of abstraction. It's a very distinguished sounds. So what is the difference between wheeze and stridor? Wheeze happens when air trying to come out, just when air trying to come out, while stridor happens with air trying to come out or trying to get in. So stridor will be a continuous
Did
sound.
she mention this is in the lectures?
Yeah. Okay.
Okay, the first one,
Yeah,
strider.
a stridor is a continuous sound. It's a continuous sound happens with inspiration and exhalation, while wheeze just happen with exhalation. Okay.
يمين بالعربية إنه السترايد
الاسترايدور
يحصل
مع
بيحصل في الاستنشاق والزفير
بالظبط بالظبط بينما
والورلز يحصل only مع الاكسل here exhale.
بالظبط بالظبط. Okay.
Okay.
What else you can mention? There is a distinguished sound which means ronchi. And ronchi, it's not a characterized sound, or it's not a distinguished. We know it by exclusion. So RH bronchi is a sound that may be also with cough. So if the patient suffers from cough and you put the stethoscope in their nose, you may listen to ronchi. Okay.
Mhm.
So these are the abnormal sounds. We're going to listen if the patient have any problem in their chest.
Mhm.
So after you've taken the history, you should focus on history of allergy, a history of medication that may interfere with respiratory system. You now make an assessment, understand signs and symptoms. You auscultate the patient. Now it's time to use some investigations to help you distinguish which problem the patient have. So what is the first thing you do as a routine investigation, Ryan? The first thing you may think of,
Of what?
investigations or diagnostic procedures you need to make to this patient to clarify the reason, the specific reason.
Like for diagnostic tests.
Yeah,
I think like lung sound or chest X-ray.
Yeah,
Uh,
lung sounds, hearing lung sounds is a kind of examination, not investigations, okay?
oh, okay,
Yeah. Now, investigation, the first thing, it's a routine investigation, it's X-ray. So X-ray is very, very important to discover if there is any problem. It helps you with mostly with if there is foreign body or there is cancer or there is fibrosis or there is TB or pneumonia. So it will help you know those things and also edema. Okay.
okay,
What else? If the patient has a respiratory disorder, so we said they have hypoxemia. So in order to identify hypoxemia, you make ABG. And ABG is arterial blood gases. It will tell you the amount of O2 in blood, amount of CO2 in blood, and amount of some electrolytes too. Okay?
okay.
Okay. What we call if the patient have lots of CO2 in their blood, it's hypercapnia.
I
Okay?
get confused.
What?
Anas.
Why?
Tell me again. Repeat it in Arabic, please.
اوكي ناو احنا هنعمل دلوقتي انفستيجيشنز عشان نشوف الامراض اللي عند المرض عند الشخص ده. اول حاجه عملناها اكس راي، اشعه اللي هي الاشعه السينيه العاديه. طيب تاني
مهم.
حاجه بتعمليها اي بي جي.
اللي بيجي هذاك اللي بينفخ فيه وتحددين
لا
نسبة
no no
ال
no 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 it's اي بي جي. You draw a blood syringe and try to put it in a machine to identify the amount of O2 in blood and amount of CO2 in blood.
مهم. cool.
Yeah, that's it. If the patient has high amount of CO2, it's named hypercapnia. That means what? It means that their respiratory system is unable to get CO2 out.
They able get is not good
No,
sign.
no, no, it's they are not able.
Unable. Okay.
Yeah, it's a very bad sign. And it's named respiratory al acidosis. Okay.
Did she mention that?
Yeah. Mhm. Don't
Oh, information so much.
don't worry. She mentioned this. Okay.
So the first one when the ثاني أكسيد الكربون عالي شو اسمه؟
Respiratory acidosis. حموضة الدم بتزيد بتعلى.
والثاني اللي هنا كاتبة بالأحمر ده عليها خط إيش هي؟
Where is it?
هايبوبنيميا ما حذفتها.
Hypercapnia, which means
هايبر.
increased, yeah, CO2 in blood. So
طيب how about CO?
what is CO? I mean CO2, yeah.
Uh-huh.
CO is not a gas found in our blood. It's not found. It's a toxic.
Mm.
Okay, what else you can ask or you can order in order to oximetry. What is oximetry? It will just enable you identify the percentage of O2 in blood. Okay?
هذا إيش؟
oximetry بيحسب نسبة ال O2 في الدم.
oximetry.
Yeah, most peoples should have oxygen saturation between 95 until 100%. Okay, until 91, it's acceptable. But below this, like 68, between 86 and 91 is considered as an it's need intervention, okay? And between 86 and 81, it's an emergency.
So this one emergency, but as the professor said, like 89, 86, if have symptom, like if you have shorty
Yeah,
breathing,
yeah,
you need to do something. But if they are okay, then mean okay, that's this their body used to it, the still low number.
yeah, that's fine. Yeah, that's right. But if the patient is under 81, it's a very life-threatening condition.
Threatening.
Yeah, and you should put him on mechanical ventilation or give him an oxygen saturation via nasal oxygenation or something, okay?
Okay.
What else you need to make as an investigation to clarify causes? It's PEFR. What is PEFR? It's a expiratory, forced expiratory. No, no, it's peaked expiratory forced respiration.
This is
Buffer.
اللي ينفخ فيه.
Yeah, this is buffer. The
Finally.
patient will exhalate air into this device. The more air they exhalate, they are away from asthma and COPD. Less air
سي
means
ابو تي ايش هو؟
COPD اللي هو السدة الرئوية.
اه
Okay, if they
سي
excrete,
او بي
yeah, if
تي.
they exhaled normal air, so they are okay. If they exhaled low amount of air, so they may have asthma or COPD, etc. Okay.
اوكي.
What else you can order? Yeah, think of it. What else?
Lung scans,
Yeah, scans. You might need
a
CT or
CT,
yeah,
MRI.
an MRI in order to diagnose what? Cancers and also pneumonia. It's a very diagnostic, highly diagnostic in pneumonia, highly diagnostic too in fibrosis. So it's very important to use this, okay?
مهم.
Yeah, that's it. I think that we mentioned the most widely used diagnostic procedures, okay?
Okay, yeah, so we don't need the thoracentesis or sputum specimen.
Yeah, we need these also too. It's important to use a sputum specimen in what? In pneumonia because it's an infection.
ايش وش هذه؟
A specimen, it's like culture. You're taking some sputum and
اوه.
culture him in order to identify the organisms that cause the pneumonia or TB, okay? Or abscess. So
هذا اللي ياخذون شيء من حلقه، بيدخلوا شوية شيء حلقه
yeah,
ويقيس.
it's like a specimen, a sputum specimen, okay?
سبوريم سبيسمم.
Yeah, sputum specimen. اللي
يعني
هو
ياخذ زي تحليل، لا
بتاخد
ياخذون
شوية بلغم وبتزرعيهم في كلشر.
مم.
اوكي. اوكي
هذه
that's
ماشينته.
yeah
ما
كل
شاء الله، ما تدري كل ده ماشي الدنيا كلها.
yeah also you make something is endoscopy. What is endoscopy? It's not actually endoscopy. It's named bronchoscopy.
ايش هذا
Bronchos
البرونكاس؟
bronchoscopy like اللي هو منظار الرئة.
مهم.
Okay, there is our respiratory system here. So you will get a device here or a tube here into alveoli to take a biopsy or to extract any foreign body here. To view everything, to view
بس
everything.
هذه يعملوها في الحالات اللي مرة يعني.
Yeah, emergent cases or something that need further investigations
yeah.
to يعني to assure. Okay.
مهم.
What else? There is maybe something here. We have two lungs here, our lungs, and there's something here named pleura. So there's a space between pleura and lung. If this is space filled with water or
water.
fluid or something, you need to extract it. Either
What's his
for
name? What's the name of this?
it's named pleural
Mm.
effusion.
Trick, write it to me in the chat because I can't read your.
What? Yeah, pleural.
ممكن هي تجيب لأن تكلمت عنه في المحاضرة هذا،
Yeah, pleural effusion.
وقالت
Like
هذا ما ينفع تعطينه مثلا كورتيزون ولا أي شيء لأنه هذا شيء برا الرئة.
yeah, that's right.
صح؟
Yeah,
منشنته.
yeah. So
قالت لازم.
yeah, you speak English because Ryan.
Okay,
Okay.
I said this is the professor. She mentioned it in lecture. She said she said the story about it. She has a client and he has water between the lung and
Laura,
like that.
yeah.
Yeah, and then this is water, and then she find out her patient use cortisone
Cortisone, yeah, cortisone.
cortisone spray, and she told me this is not gonna help you because this is out of your lungs. So
Yeah,
I
that's
don't
right.
know.
So cortisone will reach to the main problem here. So
Mhm.
the best thing is to make something named thoracentesis. It's like you insert a syringe and aspirate all the fluid from here.
Like you do construction or you take it out.
Yeah, take it out and you can send it to lab to identify if
What
it's a
this?
if it's a bloody or it's have lymph
Mm.
fluids or proteins or white BCs or any bacteria or something. Okay. And
So I
also,
have a question معلش ايش
yeah,
اسم المرض؟ اكتب لي اياه.
pleural effusion here.
خليني اكتبه.
Yeah, it's here, pleural effusion.
Let me ask the girl about it. B
Pleural effusion.
B U
Yeah, Plural. It means the accumulation of
Blur
any fluid between pleura and lung.
diffusion.
Yeah.
You said accumulation of any fluid.
What, Ryan?
You said accumulation of any fluid in. I didn't hear the rest.
Sorry. Accumulation of fluid between lung and pleura, which is the membrane that covers lung.
Okay.
So if there's accumulation of any fluid here in between those two
Okay.
layers, and you give the patient any cortisone medication or something, it will not reach to this point. So you need to aspirate this using this modality here,
آه
thoracentesis.
هذا يا أنس تيجي زي الموية برا الرئة
Yeah. Accumulation على الرئة، مية على الرئة.
على الرئة.
Yeah.
So not inside the lung.
Yeah. Inside the lung, accumulation of fluid inside the lung, we said it's edema.
Edema. So I have a
Yeah.
question about it. Was there symptom of that?
Symptoms, yeah, that's cool. The patient will also suffer from shortness of breath. Okay. And if this is bacterial, they may suffer from chest pain. Yeah,
Cool.
that's
Chest
it.
pain.
Yeah, chest pain and shortness of breath, dyspnea. Okay.
Yep.
Okay, you got it?
Yeah, Duafa, do you get it?
Yeah.
It's kind. I'm gonna listen to the lecture again. So this is good information so far now.
Okay.
Okay. I'm sorry, meeting just has 1 minute to end it. So
So I have a question. So what do you have left now? We done? We cover everything?
no, just we there is some small things like treatments or something as a nurse, actions, interventions, and we will discuss medications of respiratory system.